So among all the pediatric group, I think the neonates are the most vulnerable, and an often neglected side of their treatment is the pain management during ROP screening. We know that we do the screening in the most vulnerable. They are the less than 35 weeker and less than 2000 gram. It is a painful procedure, even if it's a small few seconds it takes us to do the screening. We do use eyelid speculum, scleral indentation, manipulation of the globe, and bright light makes it quite a painful procedure for the children. But the tragedy is that we are blissfully unaware of the pain that we are causing to them. There are certain myths and certain preconceptions in our mind that these preterm infants are less sensitive to pain than adults, and they have no memory of the pain. There's no long-term sequelae, and we are also worried about the effects of analgesia on them. But the fact is, by late gestation, a fetus develops the anatomic, neurophysiologic, and hormonal component to perceive pain. And actually, the preterms are most vulnerable than their full-term counterparts to pain and stressful procedures, because particularly they have underdeveloped pain inhibitory pathway. But we are subjecting them repeatedly to these painful procedures. And till date, there is no universal approach to neonatal pain assessment and management. The physiologic acute effects of pain are very obvious to see. There's shallow respiration, increase in heart rate, increase in blood pressure, increase in intracranial pressure. There is a shrill cry, decreased vagal nerve tone, episode of bradycardia, even apnea, and it can turn fatal even. But long-term effects are frequently overlooked. If the stimuli is prolonged and sustained and significant, it can actually alter the cerebral neuroanatomy, leading to poor cognitive outcome, motor outcome, delayed development, impaired behavioral development, growth impairment. And these children, when they grow up, they have altered pain perception. They're less tolerant to pain. Sad, my colleague, Dr. Tariq, had presented here in the past conference about such a research by us, where we have shown episodes of apnea, bradycardia, and tachycardia even happening during screening. So there are a plethora of literature out there on pain management and assessment, yet we do not follow them actually, and we are not very aware during the screening. So a good one is by Norina Witt et al., and it has given a complete guide. The actual truth is that there is validated pain scales to measure pain in neonates, and they're validated and good ones. These facial expressions we are all aware of, and these expressions are through which the validated scales are formed, and we can use them. There's also non-pharmacological methods and pharmacological methods by which we can reduce the pain. And this particular article has proposed a tiered approach to analgesia in case of neonates. Another systematic review, which reviewed a large number of articles, has come to a recommendation that it would be wise to incorporate pre-procedural oral paracetamol with intra-procedure topical anesthesia with pro-oxymetacaine, and that could be combined with non-pharmacological measures like swaddling, nestling, and oral sugar solution like 10% dextrose or glucose. But this finding actually is contradictory to what we have found in Bangabandhu Sheikh Mujib Medical University. We have done a double-blinded randomized control trial. It was done by Rumpa Choudhury, a neonatologist, with patients from Dr. Tariq and me at our ROP clinic. And 60 patients were seen. And in this study, we have taken randomly 3 groups of neonates. One was given nestling and swaddling only, group A. Others were given express breast milk, 2 millimeter, 2 minutes prior to the procedure, and the other group was given syrup paracetamol 30 minutes prior to the procedure at the dosage of 15 milligram per kg along with breast milk. And then we did the screening. Heart rate, oxygen saturation by the pulse oximeter was recorded, and the whole procedure was video recorded. Then another researcher who was blinded about the procedure scaled the pain sensation according to the PIPP scale. And this scale was done 20 seconds prior to the procedure, during the procedure, and 2 minutes after the procedure. And pain was graded as mild, moderate, severe, severe being the score more than 12. And you can find like such a video was taken, and the grader independently graded the scream, the facial expression of the child, and also the heart rate and pulse oximeter recordings were also taken into account. And through the PIPP scale, pain of this child was measured by a researcher who was blinded by the procedure, and the statistical analysis was done. So we can see that 20 seconds prior to the procedure, pain is not that much, obviously. But during the procedure, pain is 16, 14, 13, so it's severe. And 2 minutes after the procedure, pain is still there. It's moderate, but it is still there. So it's the PIPP2 level is significantly high. And when we compare between the different groups, we find that these modalities have significant effect on reducing the pain. But what we found is that from our study, we found that there is ROP screening causes significant pain with persistent residual pain even after the procedure in the premature neonates. Breast milk alone or in combination with acetaminophen, paracetamol can reduce significant pain more than that group which only received non-pharmacological like cradling and nesting. But none of these groups gave sufficient relief to the severe pain during the procedure. This is what we found, and this article by Ramna Nayak, this research actually supports our finding, where they have compared breast milk, 10% dextrose, and sterile water. They have found that all these modalities have analgesic effect, and they have similar analgesic effect, but they do not significantly alleviate pain during the procedure. So my take-home message is that we need to appreciate more the amount of stress and pain that we are causing to the neonates during screening, and our finding finds it to be of severe scale. And there is a need for consensus of an universal approach to pain management in our neonates during ROP screening. Thank you very much.
Thank you, ma'am. It's a really very pertinent issue, and something which we all should look into and emphasize.
Thank you very much.
Thanks a lot. Yeah. 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 Yeah.
It's actually done in collaboration with us in the neonatology department. The video was actually assessed for the PIPP scale by a researcher who was blinded by the whole procedure. So yes, she has done a good job. Thank you.
Thank you.